The good news for women with low-risk breast cancer is that we're very good at curing them, and we really expect the overwhelming majority of them to be cured of their breast cancer. The confusing thing for women with low-risk breast cancer is that they have several options that they can choose from in terms of their therapy. And while that is a luxury, it often also is quite confusing for them. Ultimately, it is a conversation. They certainly are a partner in that decision. I find that this sort of having that partnership is gratifying both for the patients and also for the providers. One of the biggest misconceptions in my mind when it comes to breast cancer treatment is that more treatment is always better. There are often times when lesser treatment, in fact, can provide the same kind of benefit with a lower chance for toxicities. And one of the advances that we have made in our understanding is that not every woman necessarily needs whole breast radiation. This is sort of one example where lesser treatment can, in fact, confer the same level of benefit and potentially reduce the level or the risk for toxicities. Clearly, if you can get away with just treating a part of the breast as opposed to treating the entire breast, that is something that ought to be done, quite honestly. And oftentimes, the providers are just not well versed in that literature, or they don't understand it. Patients often don't know about sort of that option, and it just never gets communicated to them. And I think that's really one area where we have a lot of room for improvement. In this day and age, cancer patients, and especially breast cancer patients, they do have to be advocates for themselves. And that often means seeking providers that sort of understand all the different options and are able to communicate them effectively to that patient. And that can be a tricky business, quite honestly. But I think, nonetheless, I think it's very important.